Hi, I'm Bill Benton, and I want to talk with you for a few minutes about medicine, healthcare. A lot of people have been talking about this lately, the Supreme Court, the Congress, newspapers, TV. I have a few things to say which are maybe a little different. To begin with, dealing with all of the problems in medical care would be a lot easier if it cost less. And it may have been lost in the discussion, but American healthcare costs more than twice as much as healthcare in any other advanced country. Germany, France, England, Canada, Japan, Australia, everywhere else, costs are less than half of what we pay, and people are healthier. I have been working in medical research off and on for 30 years. And I want to tell you a couple of things that are well known but the politicians don't talk about. One is that about 1/3 of medical procedures in America are useless. They don't help the patient. And which ones they are pretty well known. More serious, another third, 1/3 of the medical procedures are actually harmful. They don't help the patients and in fact hurt them. The people who do these procedures are paid well. They don't want to publicize it, but it's true. So that means that 2/3, well over half, 2/3 of American medicine should not be done. That is where the big extra costs come from. Other countries, like Britain, have government agencies which evaluate the effectiveness of medical care, and they don't pay for things that don't work. We don't do that. We should. That is what the evidence-based medicine idea is all about. And in fact, one of President Obama's senior advisors on medicine quit the job because Obama wouldn't listen. Nobody else would listen either, but that's Peter Orszag, O-R-S-Z-A-G. And he's a top person, a top specialist in all of this stuff. He was actually the director of the Office of Management and Budget. In other words, he's a big fish. And he thought this was the main thing that should be done in medical reform. And when it was not done, he left the government, left the White House. I read a little more about the story in a book called Confidence Men by Ron Suskind. Suskind was a top reporter for the Wall Street Journal, for 10, 15 years. He's not a beginner, and the book is really interesting, and you bet one of the characters in the book is Mr. Orszag. So that's what we need to do. We need to have a government agency which finds out which medical procedures work and which ones don't. We need to stop paying for the ones that don't work, and maybe we should pay a little more for the ones that do work, because those doctors, nurses, and scientists have been doing a good job, the ones that work. So there you are. That would solve the problem. None of the people who deserve to be paid more would suffer, only the people who are defrauding us now. And why doesn't it happen? Probably because the bad guys are paying off and bribing legislators. But that's a subject for another day. We'll talk about campaign finance some other time. Right now, thank you for listening. This is Bill Benton. I hope I'll hear from you. Thank you. Goodbye.